Hi, I'm David Pope, and this presentation is on how to tape an ankle for lateral stability. It's presented by Russell Wright and brought to you by Clinical Edge.
Hi, my name is Russell from Central Coast Foot and Ankle Physiotherapy. This taping technique is for lateral ankle support, and it's a quick and simple taping technique with moderate support. It still allows freedom of movement for dynamic sports, and it's often used as a preventative taping for when returning to sport after ankle sprain. It's an easy enough taping for your patients to do themselves, and that's why I like it. As with all tapings, the position that you start in is the most important thing. So with this taping, we want the foot in plantar, maybe even a little bit slightly everted. So it's important that your patient holds this position so that you use your tibialis anterior. That tendon's activated so it won't get a tape cut after you've finished. You could put hypoallergenic tape on first if the tape's staying on for a longer period of time, but as in most cases, if it's just for a game, you just use your rigid strapping tape. I'm using 38mm tape. You start with an anchor. That anchor comes about a third up the leg and goes with the contour of your shape of your calf, so it ends up in that kind of V pattern. That tape's put on lightly. The next tape is then started on the inside. So this is a stirrup. You pull up to the outside with firm tension on the outside. You would do 2 or 3 stirrups, slightly overlapping one another with firm tension pulling up towards the outer ankle. Then you'd apply your figure 6, starting on the inside and then coming across the ankle back towards where you started the tape. And you would apply 2 or 3 figure of 6s that come back to the medial ankle. And I like to cover up my left out skin areas so that there's no tape cuts that happen in that area. Depending on how much support you need, depends on how low you would come to the ankle. So once you've done your figure 6s, then you just re-anchor. And that is a quick, simple lateral support taping. Taping is designed to make your patients more comfortable. Always warn your patients that if it's uncomfortable, they should take the tape off. Also remind them that if their skin gets itchy, then they must also take their tape off. You can use under tape to prevent that from happening, so I use the rule of if the tape's on for more than 2 hours, then they should have under tape on. The other warnings that are important are if your toes go blue or numb or you get pins and needles, then take your tape off.